Retired property manager John Leanse never expected that struggling to breathe would separate him so immediately and frighteningly from his wife of 34 years, Julie. The 68-year-old had been coughing and increasingly short of breath for roughly a week when his wife finally convinced him to go to the hospital on March 26. Now, moments after being dropped off at the University of Chicago Medicine Emergency Department, with Julie still parking their car, doctors asked if he would agree to be sedated and put on a ventilator. He had minutes to decide. When you're faced with a decision like that, it's tough, recalled John quietly from his home in Chicago's South Loop. For the most serious COVID-19 cases in which patients are not getting enough oxygen, doctors may use ventilators to help a person breathe. Patients are sedated, and a tube inserted into their trachea is then connected to a machine that pumps oxygen into their lungs. But although ventilators save lives, a sobering reality has emerged during the COVID-19 pandemic. Many intubated patients do not survive, and recent research suggests the odds worsen the older and sicker the patient. John called his wife, who urged him to follow the doctor's recommendation. He doesn't remember much else, until coming off the ventilator 4 days later. He tested positive for COVID-19 and was pretty sick with all of the issues COVID-19 patients have, like difficulty breathing and maintaining oxygen in his blood, said Ari Leonhard, MD, one of John's physicians and an internal medicine resident who has been treating COVID-19 patients since the pandemic began. What followed was a 9-day roller coaster of events. Researchers have yet to find an effective treatment for COVID-19, and at the time of John's hospitalization, relatively early in the spread of the disease in Chicago, doctors were trying ventilators, hydroxychloroquine and an HIV antiviral drug called lopinavir-ritonavir for the sickest patients. John was treated with all three. Shortly after he was intubated, John's blood pressure and heart rate began to drop. Doctors were able to stabilize his heart, but tests then revealed that his kidneys weren't working well. The major complication of COVID-19 is pneumonia and respiratory problems, but we're also commonly seeing acute kidney injury, said Samantha Gunning, MD, a nephrologist who also treated John. Doctors still aren't sure why this happens, but theorize the kidney damage may be caused by the virus itself, or by organ oxygen deprivation or inflammation created by the body's own immune response. Meanwhile, Julie waited anxiously at home, unable to visit John because of the highly contagious nature of COVID-19. She stayed in contact with John's doctors over the phone and through video chats, and called her sisters and brother-in-law for support. You live through am I going to be planning a funeral, am I going to live as a widow, or will he be okay, said Julie, who managed Chicago Medicine's hematology laboratory for 27 years before she retired. All of those things passed through my mind. John's kidney function eventually recovered, but he also suffered from blood clots, another complication related to the virus. He was treated with blood-thinning medication for a clot in his upper arm. It was a tough road, John said. On March 30th, he had recovered enough to breathe without the help of the tube in his windpipe. Finally able to speak, he used humor to cope with the stress of illness and being isolated from his family. He had a really good way of discussing non-hospital and non-COVID-19 related things, Leonhard said. John was eventually discharged from the hospital on April 4th, and is relieved to be home and to have survived COVID-19 and being on a ventilator. You hear stories on TV about people who didn't make it. I feel really fortunate, and I'm grateful to the team that took care of me, he said. Since his recovery, Chicago Medicine doctors have had remarkable success in keeping many patients off ventilators by using high-flow nasal cannulas, tubes that deliver oxygen through the nose, but ventilators are still a critical tool for treating the sickest COVID-19 patients. Studies, however, have questioned the effectiveness of both hydroxychloroquine and lopinavir-ritonavir. Hopefully we'll soon learn more about other COVID-19 medications, like remdesivir, which has shown promise, said Leonhard. Currently, the best thing we can do for these patients is to provide excellent critical care when they're in the ICU, followed by excellent general medicine care. This story was originally written by Sarah Richards for the University of Chicago Medicine, published on June 18, 2020. Coronavirus Disease 2019, COVID-19, Information. Safe patient care during COVID-19 is one of the nation's safest medical centers. We go above and beyond state and national standards to protect your health and safety while you receive medical care. COVID-19 vaccination for patients. The COVID-19 vaccine is not widely available to the public, and patient registration for the COVID-19 vaccine is not open at this time. We are working with local, state and federal health agencies and will follow public health guidelines regarding when and how we can broadly distribute vaccine to patients. At this time, we are able to vaccinate only a small number of patients through an automatic lottery. We will share information about the availability of these vaccines through a variety of ways once authorities give us permission to begin patient vaccination on a larger scale. If and when you are eligible to receive a vaccine from us, we will contact you. This outreach will include MyChart messaging, direct patient calls and email notifications. You do not need to contact us to check your eligibility. In the meantime, we've developed material to answer many of your COVID-19 vaccine questions. How to get tested for COVID-19. COVID-19 testing is available for those with symptoms of influenza-like illness, however you must be screened before you can be tested. Our providers will determine if you qualify for a test at our curbside testing clinics. Call our screening hotline or complete a MyChart screening questionnaire. Curbside testing is not available without an appointment.